Since the coronavirus pandemic began in March, we've all been bombarded with statistics from everything from the rising death toll to infection rates and hospital admissions.
But what do all these figures really mean? Economist Tim Harford has done the maths and he says that the risks of dying from coronavirus could actually be similar to that of horse riding, being in a car accident or even taking a bath.
Well, Tim joins us now. Good morning to you. Thank you very much indeed for joining us. Your credentials, you were made an OBE for services to improving economic understanding in the New Year Honours of 2019, so congratulations for that.
Thank you.
Statistics. We are all now bombarded with stats about COVID, but I think we generally have a mistrust for them, surely, because my mind immediately went to general elections. Stats, always wrong.
Yeah, well, we're so used to them being used as political weapons. They're used to win arguments. And so we become instinctively distrusting. We sort of, it's like a magician's trick. You know, we're just trying to figure out how the trick's being done. But of course, statistics are also a way of understanding the world around us. So I think of it as like a radar for air traffic control or a telescope for an astronomer. They let you see things you couldn't see in any other way, and they can reveal really important truths about our economy, our bodies, the environment, or the coronavirus. So we shouldn't be just instinctively dismissing them.
And so I guess the stat we're all looking at is the infection rate at the moment, but also the death rate at the moment is the important one. In your opinion, from what you've been looking at, what is the real risk of dying from this virus?
It absolutely depends who you are, what you're doing, and it's changing all the time as the virus ebbs and now increasingly is coming back. But I did the sums for a friend of mine who's male, he's in his early 60s, and he just didn't want to leave the house. He thought it was too risky. And I sort of got the latest information from the Office for National Statistics, how many infections are there every day, and how likely is a 62-year-old male to die if he gets the virus. And I reckon that for my friend, the risk was about 1 in a million of dying every day, which is not nothing. So 1 in a million, if you like, we could call it a micromort. That's a 1 in a million chance of death. So a micromort is similar to the chance of dying if you go for a horse ride, or the chance of dying if you ride a motorbike. So I think of riding a motorbike as being a bit dangerous, but it's the kind of risk we take every day. And my friend is, you know, in his early 60s. I'm in my mid-40s. If you think about someone watching this who's in their 20s, the risk is much lower again.
I guess the problem is, though, isn't it, that because we are social beings and we live in households with people of varying age groups, although your risk might be 1 in a million, say, the person who lives with you, or when grandma is there, or the people you work with who lives with an elderly relative, my hand disappeared, we might just pass it on.
No, you're absolutely right. And there is evidence that that's happening, for example, in Spain, where they really got on top of the virus, they let it come back. And at first it was just 20-year-olds and 30-year-olds, teenagers, and there wasn't much of a health problem for them. In very rare cases, people get really sick or even die. But then gradually it started to spread back to the elderly population, and they've seen hospitalizations and deaths rise. So you're quite right. A friend of mine who was saying, oh, it's from what you're saying, 1 in a million, it's nothing to worry about. And I said, well, no, it's like, if you imagine if you had a car crash, and then the next day, that's 2 car crashes, and the next day, that's 4 car crashes. That's the risk we have to worry about. We shouldn't be anxious for ourselves unless we're in a vulnerable group. But we need to be really careful to avoid spreading the virus. And there are signs that it's been coming back in the last couple of weeks.
So, I mean, 41,000 people have died here. And so, you know, every death is 1 too many. But you quote Japan as sometimes you can almost be rescued to death.
There was a really striking incident in Japan after, you may remember, nearly 10 years ago, the Fukushima nuclear power plant was hit by this tsunami. Terrible disaster. It killed more than 10,000 people. And that was the tsunami, not the nuclear power station. But then as the power station started to melt down, the authorities said, well, we've got to evacuate. And that there were care homes, there were hospitals, local communities just rushed away from the vicinity of the nuclear power station, which of course you would think, well, that makes sense. But the evidence suggests that the evacuation killed quite a lot of people, And people then suffered obesity, depression, suicide in the years following the evacuation. And when we were able to reevaluate how it all panned out, probably the radiation from the nuclear power station didn't actually kill anybody. So we need to balance the different harms. There are hidden harms from lockdowns, hidden harms from social distancing measures, hidden harms from the anxiety that we feel, as well as the harms that the virus does. And I certainly don't want to minimize the risks of the virus. It's a terrible thing. It's killed friends of mine. It's killed tens of thousands of people. But we need to balance the harms and be cautious but not anxious.
So your job here is to challenge the way that stats are used, including misinformation and bad research. And really, this is what you write about, and your new book is exactly about this. Just explain that.
So my book's called How to Make the World Add Up. And what I argue is these statistics that we see all around us, they're not just tricks. They're not just political weapons. They are a vital tool. And they can save lives. We've really seen that in the case of the coronavirus. We saw it when statisticians demonstrated that cigarettes can give you cancer. And this is important stuff. It's not a trick or a game. And one of the things that I argue is we can all ask a few simple questions that help us think clearly about the world. It's not always super technical, often just a little bit of an extra internet search or just going a bit deeper. Just thinking about, well, how much is that per person, for example, or is that number going up or down? Simple questions any of us can ask that really help us see the world in a clearer way.
And I suppose that's also the same for social media. People read something on social media, whether it's a stat or a perceived fact, and are happy to run with that. And you say, stop, have a look at the facts around it.
Absolutely. Was it Yoda in Star Wars who said hate leads to fear, fear leads to anger? I mean, I don't want to sound like Yoda with a calculator, but we need to calm down when we see these claims, right? Often what we believe, we've seen it in bitterly fought elections and referendums and so on. What we believe is so often influenced by our preconceptions, our political identity, what our friends think, our emotional responses. That's fine, because we are social beings, as you said, Holly. But I think before you click retweet or like, or you share something on social media, just need to slow down for a moment. Just notice how it's making us feel. Are we feeling, yes, I was right about this all the time, I need to tell the world? Or are we feeling a kind of sense of defensiveness or denial? And even just to notice your emotional reaction to a claim, you're already a long way down the road of thinking more clearly about whether it's true or not.
All right. Thank
you
you.
very
Lovely
much
to
indeed.
talk to you
Thanks, Tim.
today.